today, I'll be going over the difference between accountable county versus managing county, as well as ending with some notes on when not to update reporting address or accountable county and associated administrative fields. Next slide. Just to recap, accountable county, this is a good segue from Phil and Alabumi's presentations, but a reminder that the accountable county is the county that the patient resided in when they were first diagnosed or when they were first reported as a case in Washington. And there's a screenshot of what the accountable county field looks like. There are, of course, exceptions. Sometimes we don't always know a patient's residential address. It can't be determined, so sometimes the accountable county ends up being the ordering provider or the ordering facility. In addition, how read and write access to hepatitis events is dictated by that accountable county field. So that accountable county field is how these permissions are primarily assigned and is an indication of who, quote unquote, owns the case or event. And just to note that these reporting address fields are available across all of the hepatitis wizards and in the administrative question package as well. And I have a note here that currently we don't have statewide view of hepatitis B and C events for LHJs at this time, like we do with COVID. So this accountable county, again, is primarily how you will gain read and write access to an event. Next slide. So for another reminder here that for reportable events, confirmed and or probable, if probable is an appropriate case classification for the type of case, always make sure that the appropriate and full reporting address is selected. You may find often that accountable county will already be populated, especially if it's a new case that was created via electronic lab reporting. But if it is reportable, you must still manually select the reporting address if there is additional information like street address or city or zip. And what's highlighted in red, that blue hyperlink in that screenshot is how you would assign the appropriate reporting address. Next slide. Okay, so that was accountable county, and now we're gonna go through what managing county is, which is actually very similar to TB's case counting county field that Phil covered today. So because for cases of chronic hepatitis, it is very common for people to move to other counties in Washington, even after they're first reported by us and by you. It's common for them to move and to continue to receive follow-up testing and hopefully care. And so we've built in what we call the managing county function to accommodate this so that access can be granted for case management purposes. So if the person has already been reported as a case in another LHJ, so accountable county is outside of your jurisdiction, this field will usually, if it's populated, this field will usually reflect the current county that the person resides in. Same caveat that through ELR, we don't always get a patient's residential address information. So this managing county set of fields is a secondary way that read and write access is assigned to local health. If you're working up a case and would like to add information to an existing event in WDRS, but you aren't the accountable county. And these particular fields aren't in any of the wizards. They are currently located in just the administrative question package. Next slide. So how does managing county typically get populated? So the two most common ways is one, DOH will update the field based on incoming ELR. So if an incoming electronic lab result has a county that is different from the jurisdiction that's listed as the accountable county, we have a workflow that will automatically update this field with the new managing county. DOH will often also update can update this upon LHJ request. There are a couple of folks who routinely reach out to us to get access for case management purposes. And so we are happy to receive and accommodate that. And I believe local health jurisdictions, you can update this for any events that you have access to as well. So it can be a way of permitting access to another county if they'd like it and they reach out to you directly. So an example of when we will update managing county upon the LHJ request. So I think typically when this happens is if a jurisdiction receives positive labs directly, maybe faxed, and they've learned that the case has been reported elsewhere in the state already. Usually this happens when a user goes in to create a new person. And even though statewide view is not available, WGRS will notify you if a Hep B or C event already exists for the person if you try to create a new person that matches someone with a Hep C or B event already. So this is shown in the screenshot below on this slide, what that notification looks like. It'll give you an event ID, but it won't be clickable because you don't have access to read, to view or edit it. So at that point, we will receive an email or a task asking for access to the event, and we'll go in and update the managing county so that the county now has permissions to edit. So some additional notes on managing county, read and write access through this field or these set of fields only works if the person's event is marked as chronic. And only the most recent managing county will have edit permissions to the case and we'll be able to search for it. So managing county permissions are not cumulative at this time. And just a reminder that the accountable county that's designated to a case or an event will always have edit permissions. And then finally, the accountable county and associated administrative fields should stay the same to reflect information at the time of first diagnosis or report, regardless of who the managing county is. And so I have a couple of more slides to go into this in more detail. So if you do have access to an event where you see that the accountable county is in another jurisdiction and the event has been reported as a confirmed or probable case, you may, because you have access for case management purposes, you may add case and demographic information to supplement what information is already there from when the event was first reported. However, I have a screenshot here of what I like to call the administrative fields. However, if you are a managing county, please do not update any of the following fields on this screenshot to preserve pertinent information at the time of initial report. So, this case here was a Thurston County case, and the investigation was done and completed in May of 2021. If this person moved to King County and perhaps we got another positive result, if you are able to access this Thurston County case as a King investigator because you're now a managing county, then because the case has already been reported, you'll want to make sure that you don't modify any of these fields, including, and most importantly, the reporting address, because we want to make sure that the accountable county stays with Thurston, since that is when where the person resided at the time at initial diagnosis. And as always, there are exceptions to all of these guidelines. So reach out to us if you have any questions or concerns on a case that you're looking at. Some other examples during which administrative fields shouldn't be updated, or really if the event has already been evaluated as a reportable case in a prior year. For example, if they've been reported as confirmed, or when a valid case definition exists, if they've been reported as a probable case, you won't want to touch those administrative fields, even if the accountable county is within your jurisdiction. You'll also notice as well that some of the administrative fields for legacy cases that were imported into WGRS at the time that we transitioned to WGRS from FIMS in mid-2018, where reporting year for these cases were prior to 2018, these administrative fields may be blank. And even so, even if they're blank, there is no need to populate these fields, which is definitely confusing, but we have on our to-do list to do some data cleanup so that it'll be more clear kind of moving forward when we get to that point. Next slide. And to end the discussion on this topic, I just wanted to kind of show you how you can identify cases that have already been reported by DOH as a reportable case. And you can do this by heading into the administrative question package and scrolling down towards the bottom of the page. There's a section for administration DOH use only. And I have the two pertinent fields highlighted in the screenshot in yellow. So the first field that will give you some information is the final case classification field. And a version exists for acute, chronic, and perinatal subtypes. So this field indicates the final case classification at the time of initial report as determined by DOH. So this is where you'll be able to tell if the case has been reported as confirmed or probable. And then finally, the year DOH field, which is underneath, highlighted underneath there, indicates the reporting year. So when the case was first reported as confirmed and or probable. And it also will tell you the year that DOH evaluated the case as non-reportable as well. So this is how you can go in to verify, to make sure that whether or not you can or shouldn't update the reporting address fields in Accountable County. And again, I can't stress enough that there are always exceptions to these rules. So if you see that the Accountable County might have been assigned incorrectly because you have information that indicates that for that reporting year, especially if it's a recent reporting year or in the year that we haven't closed out yet, in their 2020 or 2021 as of today, if you notice that you have information that where that the patient actually reside in your jurisdiction when they were first diagnosed, please feel free to reach out to us. I have a couple of more notes I have written down here. I wanted to make sure to share that if an event is identified initially as non-reportable, so your DOH is populated and final case classification is populated with other, if they do become reportable as an acute or chronic case in the future, then all of the fields on this screenshot that are currently populated will get updated by us accordingly. And data on case counts as well. Like if you reach out to DOH and you ask us for case counts within your jurisdiction for a particular year, those two highlighted fields are some of the major key variables that we use in order to do that analysis. All right,